Hi, this is Dr. Richard Singerman. What I'm going to do today is a little different than some of your other speakers. I don't have slides. Rather, I'm going to be giving you a live web demo of a project that is being funded by HHS, Agency for Healthcare Research and Quality, on the dissemination and novel methods of dissemination of evidence-based medicine. So real quickly, what are we shooting for? We're shooting for better care at lower cost. That's what the CMS triple aim is about, and that's what the Learning Health System is really out there to try and promote. And so like I said, we are a project that I'm working on in collaboration with Johns Hopkins, and as full disclaimer, I'm co-founder of the company that's developing this software, again as a full disclaimer, called TrustNetMD. Our company partnered with Johns Hopkins School of Medicine and the Bloomberg School of Public Health, and together we won a grant from HHS for this project. And so, in general, one of the big challenges, as we've seen from things like the RAND report over the years, is that evidence-based medicine is only practiced about half the time. Other half the time we're either getting undercare or overcare. So how do we basically do a better job of that? So we've done a pilot project for basically combining social media technologies with the principles of organizational learning based on the work of Peter Senge out of MIT and organizational learning. And we put those two things together, organizational learning principles plus Web 2.0 technologies, to test whether if you package evidence-based resources, whether they're for docs or for nurses or social workers or community healthcare workers or for patient caregivers, whether if you package those resources in a user-friendly, literature-appropriate grade level materials, whether that actually will enhance the adoption of evidence-based medicine and in the end lead to better care at lower cost. So for example, hospitals are currently hiring more social workers and more community healthcare workers to work with patients that have been discharged from the hospital in order to reduce the 30-day readmission rate. And at the same time, we're also interested in using these technologies for enhancing continuity of care, especially the continuity of care in the community and for community health, which involves all sorts of aspects beyond the traditional healthcare system. And quite frankly, if you can take folks in the community and keep them in the community so they're not ending up in the hospitals, that's one hell of a great way to lower healthcare costs and hopefully make a happier experience for them as well. So with that, I'm going to begin. So in our project, we interviewed around 50 community healthcare workers. We had about 5 or 6 different focus groups. We asked them what their days were like, what did they do, what were they good at, how did they work with each other, what were their challenges. And so we built from the ground up a system that incorporated their workflow. And what we heard from them at the end of the day was that their workflow really evolved around really 4 basic big areas. How do they assess the issues with their clients? How do they connect their client to resources, whether that's information resources or local community services, such as food centers, housing centers, transportation centers, job centers? How do we help overcome barriers? So for instance, let's say a community healthcare worker is having a session with a 15-year-old pregnant woman, and her grandmother happens to be in the house too and is actually causing difficulty in communication with the 15-year-old. How does the community healthcare worker somehow grab basically an assist right on the fly for dealing with that situation? And finally, how do community healthcare workers get support themselves better? So for instance, you might talk to a community healthcare worker, they might have 8 or 10 visits a day, and we spoke to one woman in Baltimore who actually had 80 to 100 different patients a month that she deals with, and she deals with the post-prison population. So there's really quite a variety of folks that we deal with. And as you see this project, one thing to keep in mind is we're going to be going live with a clinical trial for a couple hundred community healthcare workers in this project, but at the same time, to help meet the government's goal of making this broadly available to the community at large, we're going to actually be launching over the next 2 months a copy of this website, of this knowledge exchange, to the public at large that will be available for community healthcare workers, social workers, traveling nurses, nurse caseworkers, and family caregivers, so potentially a reach of literally millions of people. Anyone who has an elderly parent in the home or is dealing with a sick child in the home, they're basically a family, they are, by definition, a family caregiver. So with that, let's spend the next 5 minutes actually going through the site. So what happens? So we keep it simple: assess, connect, overcome barriers, and self-support. So if we go and, by the way, this is meant to be available on mobile devices, so very user-friendly on, let's say, an iPad mini or an Android phone up to a tablet. So we hit the assess button, and if you hit, we have basically the terms that came out of our focus groups under headings. So for instance, one could hit the term, with your finger, so you don't have to type it in, food. But if the term is not there, you can also just type it in, like child. And we come up with the search results and with different kinds of resources. So I'm just going to take you through 2 of them quickly. One resource might be a best practice from ARC on preventing obesity in children. So if we look at this resource, we have the name of the resource and basically a quick summary of it, which is a review of research ways to avoid becoming overweight or obese. And so if we click on this resource, one of the key things about this project that makes it different from other healthcare sites is there are literally going to be hundreds and eventually a few thousand resources which have all been pre-validated by a content team from the Johns Hopkins School of Medicine, School of Bloomberg Health, and in collaboration with the Evidence-Based Practice Center at Hopkins. So we're really having the highest level of people in the country who are familiar with validating evidence look at each individual resource and say, does this meet the standard? So for instance, this resource is from ARC, and so you can go straight to the resource and pull it up. And we find a really nice ARC resource on keeping children healthy at a healthy weight. And so this is meant to be user-friendly at an appropriate level. And in other words, there's all these wonderful resources that sit at ARC for the National Center for Mental Health, the NAMSA Center, et cetera. But how do you create a user-friendly wrap around it? How do you let a user basically come on and say, I have a question about this? So, for instance, you could go right here and type in the question window, and other people then chime in, and they say, oh, they chime in, and they say, this is a great article. Is it available in Spanish? That kind of thing. So that's what an information resource. But also what's really important to people in their local communities is, how do I find the best food center or the best housing center or transportation center? And here's a resource. It took about an hour to find. Well, a community healthcare worker doesn't have an hour. They have about 2 minutes. But so here's a resource on the Child Summer Food Service Program in Maryland. And so you click on this, and and we have a little description of the program. I won't read it to you, but the cool part is said, okay, click here, and you can put in a zip code and a radius in this neighborhood. So I'll just put in a zip code around Johns Hopkins, actually, and a radius of, let's say, 10 miles. And now here's a little food resource locator all around the Johns Hopkins area, and we can see where is it located, what time is breakfast, what time is lunch. I'm there for dinner. That's really a useful thing. Now, so we're basically imagining a model of crowdsourcing community resources. And quite frankly, if you look at what's going on in the United States, one of the biggest problems, it's not a problem of the information not existing, but in being in thousands of silos. That is, what are the community resources in a given community? So any community person can go in and put in food or nutrition or transportation, and they can put that resource in. And then what's really great is, let's say you want to navigate in different ways. I showed you a way to navigate in terms of search, but instead of search, there could be, people could say, okay, what do the community members think of which resource has the most views? And so here's a resource about allergy shots and drops. And so they go to this one, and this one comes from CDC. And of course, immunization has been a big issue. So a community healthcare worker can go and talk with a family about issues of shots with that family. Very timely. And the idea is, this is live, this is real, they can work with this. And it's all Web 2.0 and friendly. So instead of looking at the information resources, they can look at the different users, and they say, okay, here's some different users. Again, this is our pilot. The live thing is going in about 2 months. And so they can look at me, and they can say, oh, okay, well, I get a score of 1,000 points because I've answered 2 questions. And in fact, you can go deeper and say, what are the questions that Richard Singerman has answered? And so instead of looking for resources, they say, I don't know what resources look like, but I like following Dr. Cannon, or I like following Richard Singerman, and then you navigate that way. And finally, one other really great way to navigate, because people think differently. And so what we want to do is allow people to leverage how they think. And so they can say, okay, other people like to see, okay, what are just popular topics? So there's so many sites out there, Moms for Moms, or photography topics, or Stack Overflow is the most popular question answer site in the world for computer science questions, literally over a couple of million questions. And so someone puts in the tag child health, and then they come up with those questions. Out of those thousands of resources, they come up with those few I showed you before. The Child Overweight Program, the Maryland Food Program, or here's a program, here's a checklist. This is great, health and safety poster on making sure a play area is safe. And we heard so much over the years from Peter Pronovost of Hopkins and from Atul Gandhi in Boston about checklists. Well, basically, this is about making your checklist social. So if we could take all those checklists that are buried out there and make them social checklists to drive adoption, I know this sounds simple, but when you put it all together, now we found a way that we think makes this a lot more digestible and interesting. So overall, our concept is basically to have a crowd-sharing source for community health resources, and we look forward to people to being able to participate. Thank you very much.